Hey, good evening, everyone. Hope you ladies are having an awesome Wednesday. Sure, my volume's down on my phone. I always have to do that. Okay, we're good to go, I think. While everybody's getting on, I will say my disclaimer, as I usually need to do. Um, so, anything that I share tonight during this Wellness Wednesday is health information and not to be considered health advice. So I'll be giving some general information, right? Um, do not stop taking, or change the way you're taking any of your medications. If you need to do that or feel like you need to do that, please consult first with your prescribing practitioner. And by attending this Wellness Wednesday, tonight, this does not establish a doctor-patient relationship. And I don't know, what do you guys think of that picture in the timer? Kind of a cool story. That is during the midnight sun in Iceland, and where the sun doesn't set really ever during that time. And so that's like literally in the middle of the night. So it's pretty cool. Speaking of Iceland, and we're going to talk about the topic of exercise tonight. Um, that was a you think we'd go on vacation to relax. We didn't relax during that trip. We hiked miles and miles and got a lot of exercise. So, all right. Now, many of you might relate to this next. Well, I want to introduce the topic of exercise by reading you a question by one of you ladies, and I'm gonna read it so that I get all the details right. And I think, like I said, many of you can relate to this account, this question, and so let's use this for context and our discussion tonight. And so she says, and I'm gonna read this so that like I said, I get it all right for you. Okay. Um, she said, I was hoping to find a teaching on Hashimoto's and exercising on this list, but didn't find one. I'm asking why our bodies have such an extreme bad reaction to something that is supposed to be good. I just started with my personal trainer, and we've been doing a lot of yoga and stretching exercises to start out with. But last week, Friday, she added weight strengthening, and boy, did I have extreme muscle pain up to a level of 10 throughout the following day. I hurt from my hips to ankles, my whole legs, all sides, and my buttocks. All was so painful that I couldn't even barely press down on my legs with my fingers to touch them. I couldn't walk, barely could I move or lift my legs. Sunday, only slight improvement. Monday, 50% back, with Tuesday somewhat better. But finally able to walk again. And my appointment with my trainer on this Tuesday, I went to her and told her what happened to me. She suggested only stretching again for that appointment. But today she tried again some weights, and my legs felt like jello. And I'm exhausted today too. I hope that they won't be in that much pain tomorrow like last time. Can Dr. Red please do a deeper teaching on this? The why, what to avoid, and what helps. Greatly appreciate it. Thank you. Okay. So, just a few considerations about personal trainers. I don't have anything against personal trainers in general. Just keep in mind that they all are different, and they're all trained a bit differently. There's several different uh, methods and schools of thought that they are following, and the teachings that they've received, and they're often limited in their understanding of physiology. I'm not saying they all are, but they're often limited to in this regard. And similar to traditional medicine, many do take a cookie cutter approach to all of their clients. And of course, I'm not saying that they all do this, but keep in mind that this exercise world, frankly, I discuss the diet and exercise um, industry a lot during when I give a master class, especially the during the weight loss master class. But I did touch on it this last thyroid class, and and I gave you some bonus material on that. Um, it's I'm not saying that this is a bad thing to work with a trainer, but there needs to be some clear guidance, especially when you're dealing with chronic degenerative disease. So, our topic tonight, we're going to be discussing exercise when you have chronic degenerative disease, because clearly this lady um, was affected adversely a lot from doing the exercise that she was guided to do by her personal trainer. And so we're going to look at the why, the like she said, the what things to avoid, um, and then what things can help uh, when it comes to exercise. As as you guys all know, especially if you have a weight issue, and I'll say even if you have trouble gaining weight, if you have a weight issue, um, the doctors are always going to tell you to exercise. That's like their go-to thing. You gotta exercise. Now, they are careful to to recommend exercise if you've had a heart attack, right? If you've had um, like a an embolism somewhere, like a clot, they're careful to say, all right, no, exercise probably isn't good for you. Okay. So let's kind of keep that in the back of our mind and discuss a little bit more what we can learn from this lady's experience with her personal trainer and answer her questions. So as far as why, I'm kind of assuming she's asking why did this happen the way it did for her, right? So let's dive into that. So when you have chronic disease, like hypothyroidism, like insulin resistance, that, if you attended the class, you learned that this is a major reason, probably the major reason why you have um, the symptoms you have, the weight issues you have, the fatigue and brain fog and these sorts of symptoms, the anxiety, depression, these states, these chronic issues basically lead to you having a poor metabolism, right? Where your energy production in your cells is not great. And more of your cells go into this state where they are less metabolically active. And when your cells are less metabolically active, uh, when you push them more, logically, what's going to happen? Like, I usually give the example of, okay, if you go, if you want to go to the store, you go out to your car that's parked in the garage and it's on empty, right? Um, what what do you do? Are you going to put that car in neutral and push it to the store? I know that sounds absurd, but when your cells, and you may not realize it, I understand this because the body's amazing at and our brains we keep going, right, despite this low energy state, this low poor metabolism kind of state. um we we're not going to do that. We don't recognize necessarily when we need to slow down or stop. Okay. And our brain's going to do everything it can to keep us alive. And so it's going to cause our cells to decrease the metabolism in order to save them, literally to help them survive and not die. And so this is what happens when you have you're in a poor metabolic state. And I'm not going to go into all the whys for that. That's definitely a topic, um, huge part of the masterclass and why the masterclass takes a lot of time. But um, this is I'm telling you this because I will be doing, another one. Well, we're not ready to announce dates or anything, but we're getting that put together. So so that that we'll be discussing a lot more of these details so that you understand what is going on in your body. But suffice it to say, when you have this poor metabolic problem, uh, your brain's going to do everything it can to keep you alive and decrease metabolism even more, right? And so that's where you find yourselves, a lot of you find yourselves in this state. And so when you go to move your muscles, use your muscles like she did with the weightlifting, um, wow, that really did her in for a while. Okay, it took a long time to, days to recover. So why would our cells, what's stressing our cells so much? And I'm going to kind of get into this uh, in a little detail so that you have a better understanding. But okay, so toxins play a role. When your body's dealing with toxins, a toxic load, let's say, then the more cells that are dealing with those toxins, the more cells cannot really uh, have a good metabolic rate to function properly because the damage that's being done to the cells by the toxins, the inflammation being that they cause, will stress the cells way too much to be able to make energy too, because making energy in each cell also causes stress and through free radical damage. All right. So inflammation through free radical damage will, damage the cell too much and the cell will die. So the only thing your brain can do is say to the cell or to the mechanisms that turn the cells on, like thyroid, let's give this lady a rest, right? Let's let her rest. Don't let her have so much energy so that these cells survive. So that's what happens. And so thyroid we'll say it's uh, down regulated. It's brought down in function. All right. Other things can stress our cells and our bodies, of course. So let's just talk about stress for a minute. What role does stress play? Well, one of the consequences of stress is that your adrenals will release cortisol and other stress hormones, and that causes blood sugar to rise. That leads to more insulin production. That leads to more fat storage. Wait a second, that seems backwards of what we want. Yes, yes, but when you're dealing with too much stress, this is the way it goes. Okay. So we could look at it like on a bell curve where the first part of the curve going up to the, dividing line down the middle of the bell curve, is good stress. It helps us, you need to lift those weights if you want to build the muscle, right? Well, once you pass that midline of eustress or good stress, you're getting into distress, and that's where things fall apart. That's where you start to then create more free radical damage and get more and more inflamed, and then your cells have to shut down. That's what has to happen. And so she's feeling all sore and can't, has a difficult time recovering because she's past that point. She's past that point, that median point, and she is now in distress and it's now letting her know. So the question is, can your adrenals help you or not? Some of you are past the point where you don't even, we're past the point of producing cortisol where you don't even produce enough cortisol. You've been stressed for so long. Ladies, those of you who have had multiple traumatic experiences, you're probably there. But testing would be important, right? To verify that your adrenals are indeed unable to support you or help you with this. And so when you are then pushing your body more, physically stressing it, and you can't produce cortisol, then you're in trouble. And the inflammation rises faster because cortisol is a good thing too. We need to have it at some normal level. There's these circadian rhythm with our cortisol, and it needs to be within a normal pathway, normal rhythm. And when it's not, then we're in trouble. And inflammation happens even more because one of cortisol's job is to bring inflammation down. That's why doctors give steroids to reduce inflammation. Okay, because these steroids are derivatives of basically cortisol. Okay, human cortisol. So, um, if you, like I said, your adrenals may be able to help you or not, especially not when when you find yourself with chronic disease, especially multiple chronic diseases, autoimmune diseases, cancers, things like this. Okay. Poor nutrition certainly is a reason why this may have happened to her, because when you lack certain elements, key elements like magnesium and vitamin D, then you can be super sore because you'll develop more lactic acid. Now, I'm going to talk about cardio in just a moment and what happens with lactic acid as a result of cardio. But yeah, so when you lack these nutrients, um, and when you lack the building blocks, some of you don't eat. Look, so many of you who have weight issues, right, simply don't eat enough. You simply don't eat enough. Spoke with a woman today. She said, like right off the bat, and she said, Dr. Redd, and I really only eat one meal a day. And that's just not going to cut it. You cannot get enough protein in that one meal a day. You can't get enough fiber, enough vegetables in that one meal a day. You just can't. So you're not going to get the nutrition, which will give you the building blocks for helping your body to have the fuel that it needs when you exercise. So if you're exercising and realize, and this is going on, this is happening to you, you're having kind of a bad experience with it. It's difficult. It's tough. Um, tough to recover. It's painful. It's like super exhausting, or maybe you just get tired afterwards. It doesn't energize you like it should. Then there's a chance that you're malnourished, that you're dealing with poor nutrition. All right. Um, so talked about that. Nutrient levels um, certainly can be low when there's poor nutrition. Okay. Poor hydration can be a reason why, right? That's pretty, I think a lot of us know that. A stressed liver. Look, when your liver's stressed, it cannot detox you. And then that leads to lymphatic backup. And so inadequate lymphatic drainage is definitely going to lead to problems with recovery. Okay. So poor liver detox function, poor liver function, stress liver, however you want to say it, is going to contribute to a lack of exercise tolerance. Okay, which is exactly what this woman was dealing with. So these are the main reasons why this was happening to her. Okay, what to avoid? So of course, doing too much, overdoing it. You have to avoid overdoing it. But how do you know sometimes? Well, again, let your body be your guide. Let your response to exercise be your guide. Um, if it really tires you out, if it causes you such soreness like it caused this lady, or any undue soreness, like I know it's pretty typical to lift weights and have some soreness, for maybe the next day, but it really should be able to dissipate that soreness within 18 to 24 hours. It really should not last that long. Okay. Um, Again, because of lactic acid buildup, which happens especially with prolonged cardio and heavy weights, right? So um, that's kind of how you know. But I would also say if you have chronic disease and you just don't have the energy, okay, then doing certain exercise is not going to be good for you, right? And that's where you need guidance. That's really where you need customized care, right? That's really how important this is. Now, I want to talk to you about cardio. You want to avoid cardio. When you have chronic disease, cardio really never is, and I did say never, beneficial. In fact, most of the, mo to be honest, cardio is going to be counterproductive for anybody with chronic disease because when you have chronic disease, what I'm referring to is this low metabolic state, right? When you have chronic disease, autoimmune, hypothyroidism, diabetes, or even insulin resistance, prediabetes, even. Again, your cells are not utilizing the fuel they have, and so pushing harder physically is going to be counterproductive, simply counterproductive. All right. So cardio causes you to go into anaerobic metabolism, not aerobic, meaning with oxygen, anaerobic metabolism, which is going to greatly increase free radical damage, free radical production, and free radical damage. It's going to cause inflammation, period. And your body is not equipped to deal with that if it's already dealing with chronic disease. It's already fighting that very problem. Those of you with symptoms are dealing with this inflammation. It's counterproductive to do a cardiovascular workout, cardio workout, thinking it's going to help you. It's not. It's going to keep you from healing. It's going to cause more inflammation than it's ever going to help you. Uh, ever that it's ever going to benefit you with. So, um, what helps? Let's answer this question. When when it's appropriate, sticking with zone 2 exercise. Okay, I'm not going to go into a lot of detail with that. Um, Certainly you can look this up, but zone 2 exercise. If your energy level is above a 5 out of 10. So let's discuss what this. So 5 out of 10, and I guarantee you, if you tell me that you have fatigue, or if you're tired, or if you have low energy, it's never really above a 5. Okay, so your energy level is going to be 5 or less. So if it's 5 or less, I would not even attempt to do zone 2 exercise. You would need to go through a customized plan to deal with all the issues, uh, help turn your comprehensive diagnosis around, turn all those things around so that you can actually benefit from the fat burning uh, benefits of zone 2. Okay. So what can you do? What can help is just basic movement. If you are only able to, sit around and just barely able to get up and move, around to the kitchen, go to the bathroom, go to your bedroom, and you really can't do a whole lot else, then at least do that. At least move. And maybe, move your joints, do some mild, easy calisthenics, moving your arms above your head and moving your joints, right? Just moving the joints. General stretching is usually safe for pretty much anybody, but again, you would still really need to be guided by someone who knows about this. So movement, general stretching. Some of you might be able to do some chair yoga, and there are some uh, programs that teach you how to do that, and walking, of course. Uh, Ladies, it's not about the distance. don't set yourself up to or with expectations to be able to walk a certain distance. All right. That can push you too far because it may be farther, which ends up being longer than you can actually benefit from. And then it'll push you past the distress point into distress, and that will be counterproductive. So um, you got to experiment, maybe do a walk and try for 10, 15 minutes total and see how you feel. If you feel okay, then maybe you can go a little farther next or a little longer next time, maybe 20 minutes. But it's important that you pay attention to your body and what it's telling you. Okay. This isn't about having necessarily a positive attitude. I'm not saying you shouldn't try, right? But do what is okay for your level of fitness at this point. And if you have chronic disease and multiple chronic diseases and multiple issues, then your tolerance is going to be quite low, and going beyond that is going to be counterproductive. Okay. All right. So with that, let's take some questions and just take a few and then we'll wrap up after that. So let me see if we have any questions. I'll give you, okay, so there are some questions. The first one is, I have Hashimoto's. The skin on my left hand has changed to feel rough. Can I ask, okay, this is not an exercise question. Um, Skin issues could be caused by low thyroid that's caused by Hashimoto's, absolutely. But it's generally, um, this can also be related to a gut issue. All right. Next question. I have Hashimoto's. About 45 days ago, I stopped taking Armour thyroid, started taking some other herbs. Boy, that was a mistake. My TSH. Okay. So, um, this is a very specific question, and let's try to keep your questions to kind of some general things that I can teach everybody something about in general, because um, I mean, it's possible that you're not going to damage your other hormone markers necessarily. Um, that's again, there's way too much that goes into answering that question. So um, I wish I could help you more in this forum. You will need answers. You will need information. You will need testing, the proper testing that I teach about in my master class. So stay tuned for when we do the next one, and that will provide an opportunity for you to get more of the answers to your question. But I really can't answer that during this forum. Dr. Redd, what about playing Wii games like tennis, bowling, etc.? I mean, yeah, I mean not everybody is able to do that. Not everyone. So I can't say, oh yeah, that's great. You have to kind of experiment. Like I said, if that movement isn't hurting you or causing undue soreness afterwards, and you feel okay, even mildly energized after doing that kind of activity, then that's probably okay for you. But like I said, let's keep this kind of generalized. If the exercise causes you to be again a little more tired afterwards, if you're too sore, um, then it's probably not a good exercise to be doing. The next question would swimming be a good exercise to begin with? Well, swimming is considered more of a zone 2 exercise, and again, I would recommend only if someone has an energy level of over 5, if you can get your energy over 5, and that's without. Let me talk about that a little more. When I say that generally someone who is, um, you know, dealing with fatigue and low energy states, your energy level probably isn't more than a five. I'm not talking about those of you who are pushing past that, who are powering through, right? It's what is your energy level if you couldn't power through? If you couldn't mentally get yourself through what you need to do, what really would that energy level be? And like I said, I guarantee that if you are saying that you have fatigue or low energy, that is probably less than a five. Okay. I'm again, you may be pushing through it. That doesn't mean your energy is great. Okay. But if you feel like your energy truly is above five, then zone two exercise would probably be more helpful. All right. So swimming would fit into that category. The next one, my other doctors are constantly on me to exercise and all symptoms get worse. How do I push back? Um, well, so you would first of all tell them that you do feel worse with exercise. So logic tells you that if you feel worse with exercise, that that's something that isn't actually good for your body. And it's unfortunate that they don't know what they don't know. That's how you have to kind of look at this. Now you know more than them just from attending tonight. Okay. You know more than your doctors know, or that they're willing to really think deeply about. Because if they really went back to physiology and understood the functional nature of our bodies, they would not be telling you to exercise if they truly understood it. Okay. Um, so it's tough. I don't know that I can tell you how to deal with your doctor other than you need to find someone who can help you. Okay. How do we get to guide us on how much to exercise? I just don't know how you tell. I never feel good moving. Where do we find out what you mean by zones? It's zone two. It's all over the internet. You can consult Dr. Google for zone two. That'll teach you a lot. Doesn't mean it's good for you, but you can learn about it. Okay. So you will know by how you feel. So if movement in general is just painful, this tells us that you've got a lot going on. It really does. It tells us that you've got a lot going on under the surface. And someone like you is going to definitely need comprehensive testing for you to figure this out, for you to begin to turn this around. There's no other way around it. So um, any kind of movement, I mean, all I can tell you is just kind of keep your joints mobile, even if it's just a couple of movements a few times a day. But that's really all I can't, like I said, I can't really give you advice, but um, without knowing more about what's causing your issues, but that's how you gauge it. If you don't feel good, then it's not good for you. Okay. And it's counterproductive. And then who do we get to guide us on how much to exercise? Well, if you don't get it by now, you're part of a special group. And I really want you ladies to know that my mission is to guide you and teach you how to overcome this. And when I give the master classes, go into a lot more detail about how to find the answers that you need. It takes a lot more time than just to say, go get some testing done, because you need to know what testing to get. And and what this testing shows. And I go through all of that, and it takes several sessions. So when I do a master class, it's usually at least a three, up to a 5 day event, meaning, sessions every evening during that 3 to 5 days, where I teach you what the testing is and what this will tell you, and why you need to get all this done to be able to solve these problems. I share with you my blueprint that I've used to help thousands of women and men too. I do have male patients, but this group is for women. Um, and that's what you need to get to the next level with your help. So it's um, the next person says, my insurance pays for free yoga classes. Is that a good idea for me? I don't know. You could try it, but if it's too much, if it affects you too much, then it's not going to be good for you. Okay. So exercise is important. It's an important piece of maintaining our health. But for many of you, you have to get healthy first before you can even tolerate exercise that's going to benefit you. Okay. Otherwise, exercise is a stress. And I know I may be the first doctor to tell you this. I may be the first one to say exercise may be bad for you. But that's why I'm here. I'm here to tell you the truth, because so many of you are just on this this what am I talking, hamster wheel, just trying to do everything again. You're just on this hamster wheel and just doing the same thing over and over again, trying to listen to your doctors, and they're telling you to exercise. You keep trying, but you're not getting any better. In fact, many of you are getting worse. So that's a clear indication that you need to have different information to get different results. All right. Well, those were good questions. And I want to say too, I understand that there may be some level of frustration when you don't when you're trying to get through this and you're dealing with all this. But that's seriously why this group exists. All right. To be able to give you the answers that you need to be able to, move, like I said, move to the next level with your health. So thanks for your questions, and have hope, because there are answers. You've been given a lot of answers just even tonight, and there are more. They're out there, and I get on here every Wednesday for those of you new ladies, new to the group that are here attending Wellness Wednesday for the first time. I do this pretty much every Wednesday. Go into a topic, do a deep dive, and teach you what you need to know. So, and then be tuned in to the group when we announce the next dates for the next master class, so that you can get even more answers, and that's going to be so helpful. So, have hope, ladies. All right. Um, Remember that you still have the power to heal. So thanks for attending again tonight. Have a great rest of your evening, and we'll see you soon. Take care.